Good afternoon, everyone. We're thrilled to welcome you to another exciting and inspirational episode of Concorde Conversations. This is a new initiative by Concorde Medical Group to educate, empower, and encourage our community about their health so we can all live to our fullest potentials. We're super excited today to present you Summer Proofing Your Health. It's a discussion about anything ranging from ticks, mosquitoes, and sunscreen. So I'm Dr. Catherine Weinberg, Director of the Adult Congenital Heart Disease Program, and I'm joined by two amazing and brilliant colleagues, internist Dr. Richard Mark and dermatologist Dr. Elen Blochin. Remember, we are giving general guidance. If you have a particular question about your health, we'd like to help you. So come in for an appointment so we can give your health the attention it deserves. Let's get started.
Two main reasons that we need the sunscreen. One is cancer. It's statistically proven beyond any doubt that sunscreen protects against cancer, different types of skin cancer. And the other reason is aging. So I just wanted to show a very good visual that made headlines decades ago. Probably a lot of people are not familiar with it as much as people were before. So this is a truck driver who's been on the road for 28 years. This is his driver's side, and this is his other side. So, in addition to skin cancer, we talk more about skin cancer, but this is photo aging. So you see a lot of wrinkles, you see a lot of dark spots. That is also all caused by the sun. So it's not really the liver spots or the age spots. If we see the dark spots on the skin, it's all sunspots. Patients that the best type of sunscreen is the one that they're going to use. So whatever feels good on their skin. In terms of the requirements, it has to be broad spectrum, so it has to cover UVA and UVB. But the ones that are available in the market, they're all broad spectrum. It also has to be water resistant, and you have to reapply it every 2 hours. And even if it does say water resistant, you still have to reapply it when you get out of the water. Those are the main criteria.
Well, what about the SPF?
So it has to be SPF 30 or more. In terms of going higher or not, it depends on how much you use it. So for a regular sized adult person, you need about an ounce for the whole body. If you're applying enough of it, then SPF 30 is enough. But if you're not applying enough, then the higher the better.
Okay. Great.
If you go high SPF, it still protects you only for 2 hours. In terms of efficacy and safety, the mineral sunscreen and the chemical sunscreens, they're equally effective and safe. There really is no difference. The mineral sunscreen can be a little bit better for people with sensitive skin, because the chemicals that are in the chemical sunscreen can cause an allergic reaction. The mineral sunscreens, in that sense, they can be a little bit better. There have been a lot of talk about the some of the ingredients in the chemical sunscreens being absorbed into the bloodstream. None of that has been shown to have any really dangerous effect on our health, or any effect on the health of coral reef. So they're both safe for people and the environment. So we have a term, an ugly duckling sign. So basically any mole that looks different from your other moles. Any new mole that you get after you turn 30 is concerning. Any change in mole, anything that's itching, is painful, or bleeding, those would all be the reasons to come see a dermatologist. So definitely sunburns as a child, especially blistering sunburns, put you at a higher risk for skin cancer. Those people should see a dermatologist on a regular annual basis. And like I said, anything that stands out, anything that's different, animals that are different in color, that are not regular oval shape, that are asymmetrical. So one part of it would be one color, the other part of it would be a different color. Anything that's darker or pinker, it doesn't necessarily have to be raised. Not all the moles that are raised are bad moles. So anything of that nature.
Another important point on that, I think, is that, when you're a little kid, you're running around in the sun and you may be butt naked, right? You're just running around having a good time playing. And if you get burned, then that really raises the exposure for significant melanomas and other, significant skin cancers. So when you do have a body check, and body check is really incomplete without, really examining all the parts that are not sun exposed as adults, but may have been sun exposed as children. So,
All right.
Not sun exposed at all. Like, skin cancer can develop inside the mouth. Skin cancer can develop underneath the nails or in the genital area. So you really need a complete skin exam.
So how often do you need that complete skin exam? How often do you need a full body check?
Once a year, like all other exams.
Yep.
All right. So once a year, you need to come in and get checked out.
Ones that work the best are the highest DEET. And that's like, there's always controversy about DEET, and you really do need to get the 100% to be really seriously protected. It has never been shown to be dangerous to you, but it is shown to be very effective. So if you have a high propensity for getting mosquito bites, mosquitoes just like some people better than others, you should really treat yourself to that, because it's not just the annoying itch and everything else. Mosquitoes carry some very, very nasty diseases also, and protecting yourself from them is really critical. First thing you should do is remove the tick, okay? And that's the most important thing. So if you notice a tick on yourself, you should remove it. And then the question is, how do you remove it, right? So I find the most effective way is, you guys remember these little alcohol pads that we use before we draw your blood to clean off your skin. Well, if you get a bunch of these, and if you're really nice to your internist, he may give you a bunch. Just take it, place it. Let's see how to do that. Over the tick, hold it for about a minute, and then this is basically general anesthesia for the tick. Then just literally gently lift it off, and you'll have the tick here. You can then take that tick, by the way, and throw it away. Don't bring it to me. Don't send it to the lab.
You shouldn't keep the ticks and send them into the lab.
There's really no reason, because I think if you're exposed to a tick, within 48 hours, the best thing to do is just take a prophylactic dose of doxycycline. I mean, the CDC recommends now not even testing. If you find a tick on yourself within 48, maybe up to 72 hours, you just take 2 100 milligram doxycyclines, you're done. You don't need to be tested for Lyme. You don't need a follow-up. You don't need anything. And that's the story, unless it progresses, right? So,
right. Yeah. So I just had a quick follow-up question, because I've heard about oil. Can you suffocate the tick with oil so that it starts climbing out of the skin?
You can, but I'd rather take a dead tick than a moving tick.
But if it decides
I'm
to
with
stay
you.
out of your skin,
right, it's going to go on somebody else.
and go to somebody else's skin.
Right into the garbage, right?
A rash looks like a red patch, and sometimes it can be just an allergic reaction. So we talked with Dr. Mark yesterday that sometimes the head of the tick can stay in the skin, and that's okay too, right? It doesn't increase the chance of Lyme disease. And if the head stays inside, or any other part of the tick stays inside, your own body can react to it like a foreign body. So it can start developing a reaction, and you can see a little bit of redness and a little bit of firmness around that side. So that is all fine. That's not Lyme disease. But if you see a red patch that becomes bigger and bigger within a couple of days and reaches, a size that could be up to this big, and the center of the patch becomes lighter, that's called a bull's eye type of rash. And that would be significant for Lyme's disease.
At that point, you're obligated to take the full course of treatment because you do have Lyme disease at that point. So that's the absolute caveat. So if you do the 2, and then all of a sudden this rash appears, then you have to do the full 10 or 14 days of dox. In addition, if you don't see any rash, or you don't notice anything, and within a week or 2, you have a really weird flu type syndrome where your joints ache and you're headachy, you're lethargic, you can pretty much assume that you have Lyme disease at that point, and you would do the same thing, take the full course of the doxycycline.
So anything unusual that happens during hiking or after hiking would warrant, additional attention.
Right. Yeah, I think all of the tick-bornes that are not Lyme,
Mm-hmm.
their main presentation is, we call encephalopathy, where you're getting a lot of headachy eye, foggy eyes, but really bad headaches like you're not usually, you don't usually have. That's definitely a red flag. Right. But you should have that. If you live in areas or you go vacation in areas, you should always have a bottle of doxycycline with you. I just give patients a prescription to just keep it for the summer.
All right.
You might not even see it because commonly they can hide in your, in your head, in between your hair. So don't see in it necessarily.
Got it.
If you're in a high tick area, you should do a body check with with your partner or a stranger. It's up to you, but you get full body check for tick areas you obviously can't see. Just have them take a look because they're tricky. They find strange places to hide. All mosquito bites are annoying, right? So they're going to know that you've got mosquito bites. They're going to be itchy. You talk to what you can do about that. They carry also nasty viral illnesses. That is a lot trickier. So if you get a mosquito bite and you develop those same types of symptoms, those headachy, vision change symptoms, extreme lethargy, you need to go, and shorten your vacation and see your internist because, there are multiple viral illnesses carried by mosquitoes. We have outbreaks of West Nile every once in a while, but there are lots of others too. But I think the caveat is that if you're feeling sicker than you should be feeling with just a passing, cold or whatever, you should at least call your internist.
So in terms of stopping the itch, ice works really well, and there are a couple of over-the-counter options that are available. One is the hydrocortisone, cortisone 10, and the other ones are the pramoxine-containing lotions. So pramoxine is a topical anesthetic. It's Pramoxine.
Very good.
Did you notice how long it took me to spell that? There are 3 brands that I'm aware of that make it: Aveeno Itch, CeraVe Itch, and Sarna Lotion. They work pretty well. Keep them in the fridge. When they're cold, they work a little bit more efficient, more effectively. You can use them as often as you need. The one advice is to stay away from Benadryl because it just doesn't work. Topical Benadryl, I'm not talking about the pills, but the Benadryl lotion or gel is just not gonna help, and it can make the matters worse. Because a lot of people develop allergies to it, so it's gonna make it only more itchy.
3 of these a day to start, right? This is 1.5 liters. Yeah, okay. 4 liters of water, 4 quarts of water is good maintenance. Then you have to subtract for any of your negative water. So that's caffeine. Any caffeinated beverage is considered negative water. So, 1 cup of coffee equals 2 cups of water. So you have to pay back the liquid because of the diuretic effect. Alcohol, same story. Everybody knows that when you're at the bar, you should match a glass of water for every drink so that you don't have a headache in the morning. It's all part of the same process. But hydration it's the biggest fight I have with people.
My mom is always afraid to properly hydrate, especially if she's going somewhere, because then she's worried that she's going to have to go to the restroom.
Right.
So I always have that fight with her.
Right. So it's an interesting misconception, right? Because if you decide I'm not drinking because I'm going to be taking a long car ride, so you don't drink for a while, what happens to your urine? It gets nice and concentrated, and it actually is irritative to the sphincter. So then you start getting this you don't have that much urine, but you have this constant urge to urinate. If, however, you were well hydrated and your urine was appropriately dilute, it wouldn't be irritating the sphincter. You might have to stop once and you would have a good, full urination and then just go on. But this way, you're going to feel like you have to stop every 20 minutes. So try it yourself if you don't believe me, because it does work that way. The more concentrated the urine gets, the more irritation to the sphincter, male or female, and the more often you're going to be stopping for tiny little pees. You know?
Okay. Unfortunately, no. So it hydrates everything except the skin. If you want the skin better hydrated, you have to do something from the outside, not the inside. I think we know a lot by now. We know that sun is not good for us. We know that we don't need to be out in the sun to get our vitamin D. We can just take the pill. It's a lot safer. I think it's just a matter of actually following the recommendations that are out there. Going for checks on an annual basis, paying attention to your skin, paying attention to your partner's skin. So just following the right advice, not taking advice from the sources that are not very reliable.
I think also another misconception, just because you use sunblock doesn't mean you don't get the benefits from the sun, because there are other benefits from the sun, right?
Exactly.
So this whole thing about people, what the winter's like, and we have the seasonal affective disorder because we're not getting enough light on our pineal gland and our brain and whatnot, but you're still getting those benefits. So it always feels great to be outside in the sun on a beautiful sunny day, but you don't toast yourself.
Yeah. And I always tell my patients, go ahead and enjoy it. Just protect your skin. You don't have to hide home from it. You just have to, take a couple of extra steps.
Yes. And that way you exercise, which is another really important part of living a healthy lifestyle.
Yeah.
Right.
Absolutely.
And so hiking is great exercise. I'm sure sailing is great exercise too.
It can be.
Well, it depends if you're sailing the boat or if you're just relaxing.
Depends on the weather behind you, actually.
All right. What about you, Dr. Mark? What's your action step? What would you recommend?
Mine is drink a lot of water, exercise regularly, use your sunblocks appropriately, but don't be afraid of being outdoors, and see your internist once a year, see your dermatologist once a year, and, have a bunch of alcohol pads with you, a bucket of water. You'll be fine. That's all.
Yeah.
But do take, certain symptoms very seriously, and those are, the symptoms that are atypical for you. So, a mosquito bite followed by a severe headache, an expanding rash from a tick bite. These are things that merit a phone call at the very least.
Yes, I agree. So this has been a quick 30 minutes. Thank you all for joining us for another inspirational and educational episode of Concorde Conversations. We know many of you have additional questions, and we'd love to help answer those questions. So if you have any about your health, please come in so we can help you. We care about your health. Thank you so much.
Thank you.
Bye-bye.